everyone. Thank you so much for tuning in to some JAK tips. So I'm going to tell you everything you need to know about this new class of medicines that we've been so excited about in just about 2 to 3 minutes. So we're going to jam pack this with a lot of good information. Hopefully it'll increase your knowledge and comfort level with this exciting new class of medications. So far, we have 3 JAK inhibitors approved for the treatment of atopic dermatitis. We have Opzelura, or topical ruxolitinib. We have oral Rinvoq and oral Cibinku, both approved for the treatment of moderate to severe atopic dermatitis. And this is so exciting. We have been waiting for these JAK inhibitors for a long, long time. And the way JAK inhibitors work, it turns out that these JAK enzymes, these Janus kinases, play a crucial role in keeping inflammatory processes going. And so the inflammatory process of atopic dermatitis, for example, these JAK enzymes kind of fuel the fire and keep it going. So if we are able to inhibit JAK, we inhibit that inflammation and we decrease the atopic dermatitis. Talking first about Opzelura. Opzelura is pretty exciting. It's a topical approved for the treatment of mild to moderate atopic dermatitis in patients age 12 and up. So that's exciting. We can use it down to the age of 12. It is a medicine that I have found patients love. It is easy to apply. It is a cream that rubs in completely. It does not sting or burn. In fact, stinging and burning was more reported in the vehicle group in the studies than in the Opzelura group. So it is very tolerable cream. It is a very effective cream, and it works pretty quickly too. So far, since Opzelura came out in November, my patients have given me very positive feedback about the use of Opzelura for their mild to moderate atopic dermatitis. Next, we have the oral JAK inhibitors. So we have Rinvoq or upadacitinib, which is approved down to the age of 12, and we have Cibinku or abrocitinib, which is approved down to the age of 18. And these are exciting oral medications that really are quite effective for our patients with moderate to severe atopic dermatitis. They do work really quickly. So these are medicines that don't really have to ramp up. They're kind of ramped up right out of the gates. And so the efficacy, especially with regards to itch, tends to kick up pretty quickly, and that's exciting for our patients. We do have to deal with some safety considerations with these oral JAK inhibitors. It's appropriate to do blood work. We check a CBC, CMP, and lipid panel at baseline at month 1 and then every 3 months after that. It is also appropriate to be checking a quantiferon gold, hepatitis B, and hepatitis C before you start these medicines. With these oral JAK inhibitors, you really want to make sure that the patient is healthy going in. You want to do screening labs to determine if they have any liver or kidney issues that might impact your use of these medicines. You also want to ask about a history of cold sore virus because these medicines might be associated with an uptick in episodes of the cold sore virus. And if patients are of an age where it's appropriate for them to receive a shingles vaccine, you'd want to encourage them to do so because there does appear to be an uptick in shingles infections in patients on these oral JAK inhibitors. The last thing that's important to talk about with regards to these JAK inhibitors is, of course, the black box warning. The black box warning was placed on this class of medicines because of some study results that stemmed from a Xeljanz surveillance trial. Xeljanz, of course, being another JAK inhibitor approved for various conditions like inflammatory arthritis and ulcerative colitis. Because of that, we have this black box warning, which details a potential increased risk for serious things like blood clots, heart attack and stroke, immunosuppression, skin cancer, and lymphoma, and possibly even increased mortality. So these are serious risks to be educating our patients and their families about, but I would also emphasize that these are rare but serious risks, especially in our patient population. Most of the data from Xeljanz that prompted the black box warning stemmed from a study where the patients were over 50 years old with at least one cardiovascular comorbidity, and they were inflammatory arthritis patients. So not generally consistent with our patient populations. Still, however, important to discuss with our patients and their families. And that's pretty much JAKs in a nutshell. Thanks for listening.